My name's Orla Lawson. I'm one of the pelvic health physios here in the South Eastern Trust. What we do with the pelvic health physio team is we would see men and women with different symptoms or issues affecting the pelvic area and see if we can help to improve those for them. You've been referred to the pelvic health physiotherapy team with symptoms of bladder leakage, rushing to the loo more often than usual, or prolapse. Other symptoms that we can also help with are bowel urgency, frequency or leakage, constipation and pelvic pain. Many of these symptoms occur when your pelvic floor muscles don't work as well as they could and can be improved by training these muscles properly. Your pelvic floor muscles form a sling or hammock that spans across the base of your pelvis. They are important in stopping leakage from your bladder or bowels, supporting the organs of the pelvis, and keeping vaginal tone, which helps with sensation during intercourse. These muscles can stop working as well after giving birth, approaching or after menopause, and after gynae or abdominal surgery. Other factors that can affect them are long-term constipation, repeated heavy lifting and straining, or chronic or long-term cough. Stress incontinence refers to leakage from the bladder, where there is a stress or pressure down onto the bladder, such as when we laugh, cough, sneeze, or exercise. Working on your pelvic floor muscles can help stop this. Try to squeeze your pelvic floor muscles when you feel a cough or sneeze coming on, or when lifting or exercising. You should also work on managing the pressure on your bladder. For example, try not to hold your breath during heavy lifting, exercising, or emptying your bowels. A normal bladder lets you know when it needs to empty, but gives you time to finish what you're doing and make it to the toilet. Sometimes the bladder can become overactive or oversensitive, making us want to rush to the loo suddenly and more often, or waking us up in the middle of the night to empty. These symptoms can be made worse when we go to the toilet just in case, rather than waiting until we have an urge to go. Sensors in the bladder can become irritated when we drink caffeine, fizzy drinks and alcohol. So it's worth trying to reduce these if you have symptoms of overactive bladder. You may find switching to decaffeinated tea and coffee is an easier change to make at first, though keep in mind that drinks such as decaf and green tea still contain some caffeine. Aim to drink 1.5 to 2 litres or 6 to 8 glasses of fluid a day, ideally water. Strong pelvic floor muscles can help to hold the urine in until we get to the loo and calm the urgent signals in the bladder, so training these muscles can also help. If you do feel you run to the loo often, try holding off for a few minutes to see if the urge subsides. If your bladder wakes you during the night, it can help to get most of your fluid intake earlier in the day and reduce fluids in the evening, in the period of 2 to 3 hours leading up to bedtime. A prolapse is when the bladder, bowel or womb are no longer supported in the pelvis and start to drop or slump downwards into the vagina. You might see or feel a lump in the vagina. You may experience a heavy or dragging sensation vaginally or in the lower back. You may have difficulty emptying your bladder fully or emptying your bowels. Tampons may fall out, or you might notice a discomfort during intercourse. As with stress incontinence, the key is to minimise unnecessary downward pressure into the pelvis and strengthen the supporting pelvic floor muscles. Breathe out when lifting or during any effortful activities. Bear in mind that for many people, pressure happens when we strain to empty our bowels, such as when we are constipated. Avoiding constipation is a really important part of managing bladder and prolapse symptoms and keeping your pelvic organs and tissues as healthy as possible. Ensure you have a diet rich in fibre, especially vegetables and fruit. Make sure you're well hydrated. If you have trouble emptying your bowels, these tips can be helpful. Try placing a low footstool under your feet to raise your knees higher than your hips. Take 3 or 4 slow, deep breaths, allowing the pelvic floor muscles to relax. Imagine your waist widening as you breathe in. Relax your belly and don't be afraid to take your time on the loo. Aim to keep your back fairly straight and lean forward with your forearms resting on your knees. A long breath out can help as your bowels open, and try not to hold your breath or push down into the pelvis. So now we'll look at how to exercise the pelvic floor muscles. Best position is to begin with lying down or sitting. Nice and well supported, relaxed and comfortable. Feet are on the floor if you're sitting. We want the buttock muscles, the leg muscles and the tummy muscles to stay nice and relaxed so we can really isolate those internal pelvic floor muscles. Take a few nice breaths just to make sure we've let go of the belly, hips are sinking nice and soft into the chair, and we've dropped the shoulders. Keep breathing nice and normally and relaxed throughout. So to think about engaging our pelvic floor muscles, we want to start by imagining we need to pass wind, and we're trying to do a little tightening of that ring of muscle around the back passage, as if we're trying to stop that wind escaping. So a little tightening and a drawing up inside, while keeping those hip muscles nice and relaxed. If you can start to feel a little tightening there, see can you engage then the muscles a little bit further forward vaginally. So again, tightening, drawing up inside, and then bring that all the way forward towards the bladder at the front, but keeping the tummy muscles relaxed. This is our pelvic floor muscle squeeze, and then we want to completely relax them back down again. So feel the muscles release completely after every squeeze. So if you can feel that good pelvic floor muscle squeeze, we want to set up a program of exercises, and we do 2 different types. The first we'll start with is our long hold. So we engage the pelvic floor again, starting at the back, drawing up inside from the back through to the front, and try and hold. And again, it's important at this point to relax the rest of the body and keep breathing. Sometimes counting out loud can help to keep the breath flowing. Once you feel those muscles start to tire or let go a little bit, see if you can pull them in a little bit more. If you can't, let them relax. And whatever number you've counted to, that's your guide to start with for your long hold. Release them completely, let them release and relax for a few seconds, and then try again. So we're drawing up from the back through to the front, doing our long hold, counting to see how long that's for, and then relaxing them down again. Continue this up to a 10-second hold or 10 repetitions until the muscles really start to tire. In the beginning, if the muscles feel a little bit weak or it's difficult to isolate them, you might just start with 2 or 3 seconds, and that's fine. Build each week, trying to aim for a little bit longer and an extra repetition. Then let them have a good rest, and we want to work on the short squeezes. This is for the times when we need that quick response, like with a cough or a sneeze, and we want them to pull up nice and short and sharp and strong to help control around the bladder or support the pelvic floor, pelvic organs. So we want to do a nice, good, strong, quick squeeze in, and then immediately release all the way back down. It's important that you don't pulse the muscles. Do your short squeeze and fully release before you go to the next one. And again, these ones you can build from a couple of repetitions and progress by building towards 10 repetitions in total. And that's your set of pelvic floor muscle exercises. So that's one set done. You want to try and do 3 to 5 sets of those in a day when we're really training those pelvic floor muscles to help combat any of the symptoms that you're experiencing. Once you become better at them, you might find you can try them in standing. So you're working against gravity, going to be much harder. It's going to test the muscles a little bit more, but it's a good way to progress on to a more functional position. At the start, you'll find that you really have to concentrate on the exercises. So it's not something you can necessarily do while you're watching the TV or washing the dishes in the beginning, because we want to isolate those muscles and make sure the technique is good. With a bit of practice, that should start to become a lot easier, and you'll find it's much easier to engage those muscles without having to think so much about it. So they should get better with practice and time. Like any muscle in the body, it's a use it or lose it type of mentality. So if we stop exercising them, they start to lose that training and that function. These are exercises you want to do every day for the rest of your life. Build them in consistently to something as simple as the same way that we brush our teeth every day. We want to look after our pelvic health and exercise our pelvic floor muscles every day. So keep going from now and forever. Sometimes people can find that the exercises are a little bit easy to forget to do. So it can be useful to put a little sticky note somewhere that's visible that you know what that little reminder means. Set a reminder on your phone And there are some apps that you can get for your phone that can be useful to help remind you as well, such as maybe the NHS Squeezy app. So that's your pelvic floor exercises. Have a go at those and see how you get on.